My name is Dr. Gerald Chodak. In another video on my prostate website, I provided information about the radical robotic prostatectomy, what it is, how it's done, what's good and bad about it. In an effort to provide additional information for those considering this operation, I provide in this video an interview with a man that underwent this operation about 1 year ago. Hopefully this information will augment the other information provided as you make your decision on what to do. Hello, can you please tell me what your name and age is?
Don Lavin, 65.
And what's going through your mind as you're approaching the day of surgery and actually the morning of the operation?
I wasn't concerned about passing away from a problem during the surgery. Like any man going into a prostate surgical procedure, you're worrying about incontinence, sexual function, recovery period, your ability to get back to work. But I had been told by a number of sources that I would probably be successful in all these areas.
So in terms of helping other men that are going to go through this, any suggestions you might have to help other men prepare mentally or emotionally to get ready for that day of the operation?
Well, my surgeons kept telling me that they were very pleased with my positive mental attitude, and they told me that that goes a long way towards having a successful procedure.
I think you mentioned that you ended up choosing the robotic surgery.
Yes.
How long were you in the hospital?
I went in at 9 in the morning and had the anesthesia prep. 45 minutes later, I walked into the operating room, said hello to the machine, laid down, and the next thing I knew it was 6:15 in the evening.
Many men are afraid of the pain that an operation might cause. How much pain and discomfort were you in both the night of surgery and the next day until you went home?
It was shocking to me that there was virtually no pain whatsoever. I kept thinking there was incisions inside, but there was no pain. Slight discomfort with the catheterization, but when they told me about 10 o'clock at night that they wanted me to get out of bed and go for a walk around the hospital, I thought they were kidding, but in fact I was able to get out of bed, and I stayed out longer than they advised because I was having no problem walking.
So you go home the next day, and now you're taking something for pain. How much pain are you having on a scale of 0 to 10?
I wasn't having much in the way of pain, more discomfort, and I was given prescriptions, but I only used Tylenol PM and Advil. I didn't take any Vicodin or anything else.
And that was sufficient? You didn't need any narcotics?
Didn't need any, no narcotics, nothing else, and sometimes I didn't even take those.
Now, of course, you went home with a catheter in your bladder. What did that feel like? How much discomfort did it cause? Was it hard to walk around? Give us some idea of what a catheter feels like.
In the beginning, the catheter does give you some discomfort, and you're concerned about movement, but with the modern catheterization and having it strapped to your leg, I found that that was not as much of a problem as I was worrying about.
And how rapidly are you starting to resume some of your activities? Walking, driving, showers, getting out and about? When did you go to dinner, for example?
Good question. First of all, my doctor wanted me to walk as often as possible within reason. So I would get up and I'd walk around the neighborhood a little bit. I'd walk around the house a lot. I'd walk up and down stairs. And every day I would push it a little longer. Believe it or not, 4 days after the operation, I got in the car, drove over to a restaurant in the neighborhood, wearing my warm-up suit, my catheter strapped to my leg, had a wonderful dinner with my wife and friends who met me there who didn't even know I had had the operation. And to this day, they don't know I have had that operation. So I started resuming driving even though it was against the doctor's advice within 4 days.
Were you surprised at how quickly you were recovering from this? Did you think it was going to be more difficult to go through? Or?
Absolutely. Absolutely. It was stunning.
So then how long did it take before you went back to work?
Well, I started working within 2 or 3 days from my house, and I went back to the office within 4 days.
So then when did you next go back to meet with the doctor?
6 days later, the following Thursday, I drove to the hospital, and within a few minutes, they removed the catheter and sent me on my way.
Was it uncomfortable with the catheter coming out?
No, it wasn't. I was given horror stories by friends of mine who were playing with my head, but the bottom line is it's nothing.
And what about the staples? A lot of men are worried about getting staples out of the skin.
And, they eventually just dissolve and leave.
So you didn't even have staples? You
No.
just had a few stitches underneath the skin?
Yes.
Okay, so now you're out a week, you get the catheter out, now you have to go through your recovery. Obviously, you're going to be faced with some urinary leakage difficulties. How did you cope with that? How much leakage did you have? And how is it affecting you psychologically or emotionally?
I was fortunate in that I didn't have a lot of leakage. I went through initially 3, 4, maybe 5 pads a day. I went and prepared in advance by buying the Depends type of male underwear, and I would put pads within that so I didn't have to change the entire ensemble throughout the day, just a pad or two here and there. I found that after 3 weeks or so I was using less and less pads, and after 4 weeks virtually didn't need any at all. I still carried some for protection, and in this regard I do have a tip for everybody. Don't wear light-colored pants. Don't wear khakis. Wear black jeans. Wear black because you never know. It's not just whether or not you're having incontinence problems. If you have a coughing attack, if you bend over suddenly to pick something up, things can happen that you absolutely don't have any control over. You start sneezing too much. That can loosen up the bowels. Not the bowels, the urinary tract. So try to wear dark clothing, and in the beginning, make sure you have warm-up suits with expandable waistlines that don't have belts. You don't want constriction on the waist. Much more comfortable.
In talking with other men, did you get a sense of how long it might take for your urinary control to improve? Were you afraid it might take weeks, months? You improved quite quickly, it seems.
I did. In talking to a number of other patients, I've found that some people have recovered quicker than I did, and some it took much longer. So it's an individual situation. I was fortunate that within 6 weeks I was using no pads whatsoever. I know people 3 months later that were still using pads.
Let's talk a little bit about sexual function, which is the other major side effect.
Mm-hmm.
What did the doctors tell you about the likelihood of your regaining complete sexual function or having problems with it? Did they give you any statistical information, like the odds are 10%, 20%?
I don't recall them using statistical percentages. They did tell me I had lost some nerve, but that it was a very good chance that I would be able to maintain sexual functions, and it turned out to be the case.
So compared to how you were prior to the surgery, how close are you back to normal? 80%, 50%?
I would say about 75%.
And was there anything you did to help the process of recovery? Did you take any medications? Did you use any other tools that the doctors might have recommended?
The doctors prescribed Viagra to be taken on a regular basis. I did not take them as often as they would have liked because they do have certain side effects that bothered me. But in point of fact, Cialis, Viagra, everybody is going to get a prescription for those. You take them, and they are effective.
Are there any other words of wisdom you might relay to other men that are considering having surgery as their treatment option?
A lot of factors go into the decision making. Rely on your doctors. Maybe you should have a consultant who's not a practicing physician that can help you down the path. I had been given recommendations to have some procedures that were only performed out of the country. I rejected those, even though my friends who have had that procedure felt comfortable with their decision. I realized that certain procedures will have an effect on whether or not you could have surgery thereafter. I took the course where I didn't want to have nerve damage from radiation or HIFU or anything else that would preclude my having surgery or impair having surgery at a later date should the need arise.
Well, I want to thank you very much for sharing your thoughts and feelings and reactions to this operation, and we wish you well.
You're very welcome, Doctor.
I want to thank Mr. Lavin for sharing his reactions and feelings about the experience he had with the radical robotic prostatectomy. Please keep in mind that this is just one man's experience, and there's no way to predict whether your experience would be exactly the same. But I do believe it does provide useful information to you as you weigh your decision options on how to treat your localized prostate cancer. Thank you.